Yeah, it's just annoying. It's like, best way I could describe it, I hope I haven't just said this, best way I could describe it, if you've ever had long hair like I used to have most of my adult life so far, when you take your hair out, you get the hairband and you want to wrap it around your wrist, you know. Imagine that, but really, really tight, and it cuts off your circulation. Well, that's what it feels like. You lose sensation. In fact, that on that corner, which is now wet, in the corner of my hand there, it's really quite dead. So I'm hoping that will come back. Oh my God, there's a queue.
2 hours later.
Well, short update, spontaneous update as usual. I've had the hand done, carpal tunnel release. By far and away the thing I will remember most, and not trying to put anyone off, is that everything else went fine. The part for me that really didn't go down too well was when they gave me the twilight medication through an IV drip. It really hurt a lot, like burning hot battery acid. And I actually thought, how am I going to tolerate this? But luckily, you know, finally it doled out. So aside from that, all good. It is now midday, heading back home. I'm not sure what time the actual operation was, somewhere between 8:30, but it's probably 9 o'clock. And didn't take long at all, because as usual I had a bit of fun in the laying there, where most staff, you know, they like my sense of humour, but a couple of probably don't. I was virtually told to shut up, but in a polite way. Yeah, it didn't feel a lot. It felt a little bit of pressure, just cutting like they said I would, but I just got them to bump up the meds, and it's all okay. So I just sort of go home and have a bit of a sleep. Yeah, I have to have this on for a week.
3 days.
Sorry, yeah, 3 days. And come back in a week to the hand clinic. Yeah, well, we'll see if it was all worthwhile. It's still numb at the moment, but yeah, so what do I say? But let you know, I guess, in time whether it was worth doing. Okay, stay tuned. Okay, so I was just falling asleep editing this together. Came home, tried to have a nap, fully expecting that I'd maybe get a decent nap because you know, I'm pumped full of all the sedative and everything. I only got 15 to 20 minutes, so that was a bit of a bugger, but it was a good sleep anyway. So I thought I'd throw that together, what you've just seen, and just stick a little PS on the end, and a slight update a couple of hours after that. It's now about 4 p.m. Got a bit of a achy feeling through the hand. It's not unbearable. I have topped up on the painkillers, so I'm kind of off my face a bit. But anyway, people that know me wouldn't notice any difference anyway. The fact is, yeah, while I was just editing there, I was looking around for a file, and I came across a little recording I made of 2 years ago when I first went for the results of the diagnosis of the nerve conduction test, and I was quite surprised what I heard, that actually the left hand numbness and everything had an additional problem, which is the ulnar nerve, or ulnar nerve, I think, in the elbow. Well, I don't know. And they wanted to do this hand first, which isn't as bad. So look, we'll just see what happens. It's just something I just discovered, and thought I'd mention it. I mean, I've been seeing a chiropractor for maybe heading towards 3 months, who's very brilliant. So it could well be that because my spine has been straightened out a lot more, my nerves are freer, and it may not be an issue. nothing we can really do unless, you know, give it a few days for this to heal and see if the numbness has improved. Anyway, look, what I'll do, I'll tack that onto the end of this video, just over a still frame, and just the highlights. I mean, there's about 15 minutes, but the main diagnosis part is about 3 minutes, so I might chop down just the highlights of that if you're interested. But okay, so far, yes, I mean, I'm glad it's over with. Will I do it again for this hand? I don't know. If I was to base it on the extreme pain of getting the medication in the IV today, so I don't think so. That was really bad. But then it's funny, isn't it? If you're watching this video, unless you're just a regular subscriber, you've probably searched for the topic, and you'll find all sorts of variances. Like there's a woman, I'll actually add her tag down in the description, and she was out in an hour. She was making a little vlog about it. So yeah, it's funny, people have different reactions. You can never be too sure. I am glad that they did it endoscopically, which is a little cut here. When I update you in a month or whatever, or a week or so, I'll show you, but it's just a little cut right along the line of the wrist there. And the other one I didn't know about is they also do a little cut there. A camera goes in this end, and the actual endoscope, which contains the scalpel and everything, goes up through the wrist there. But hey, the alternative is the traditional style, where basically they put a cut right there, maybe not quite that long, and that normally is the one that takes a lot longer to heal. Because, you know, you're cutting through all those nerves and everything too. So yeah, we'll see how it goes. I'll try and get a bit of a nap in before I publish this, but yeah, but I may as well throw that PS in. So leave your comments below if you've had the operation. It's, like I say, it's been probably 2 to 3 years since I've had the symptoms. And if you follow me on Facebook, by the way, welcome Craig. Hope everything went well today. That was a real excellent thing to happen. Yeah, if you follow me there, you'll get updates on this, that and the other anyway. It's just, the main one is my personal Facebook page. It's just me. I have an acting channel there as well, but yeah. But yeah, you'll see updates. Yeah. I don't know. I'm thinking on the fly. You know, if you have the problems, put it this way. I was seriously thinking, do I just back out beforehand? I mean, I can live with it, and I could live with it, and I have lived with it for the better part of 3 years. It's not, for me, it wasn't painful. But then, hey, I've got it done now. If this takes care of it, then I guess I'll go, oh, well, that's good. I can feel things properly again. It's always a bit indecisive if you've got a major problem or major pain, then obviously you want to address that. But when it's something that you can live with, you know, which pathway do you go? I mean, I'm now pumped full of God knows what, I guess, sedative that didn't. Did I mention it? I didn't go to sleep. It was what they call twilight sedative, and I thought maybe I'll doze off. Some people do, but she said because of my breathing, this, that and the other, they don't want me to go that deep, so that this way my body will still keep breathing, which is always a handy thing, I suppose. So basically, it did nothing. I didn't feel calmer or anything. May as well have popped a couple of Valium, I would have felt better. Yeah, so it's funny how we're all different, even though we look similar. Okay. Alright, thanks for joining me, and thanks for supporting me, and thanks for watching the video, and thanks if you have given me a thumbs up for any of my videos and subscribed, and thanks especially if you've shared. Yeah. Alright, what I am going to do regardless is try my very best to just take it easy for a week. You know, it's not always even. Just bugger everything else. You know, bugger the whole lot. I don't want any stress. Please, just give me stress-free for at least a week. Thank you. And stay tuned for updates. Now here's that little recording of the highlights of it anyway. Just FYI. See ya.
This hand is going to be easier to fix than this hand, because this one is just a carpal tunnel. What I'd probably do is do this hand, get this hand good, because this one is a lot more complicated. Because you've got one nerve is getting blocked at the wrist, and the other nerve is getting blocked at the elbow.
Is it the bone that's blocking them? Or?
Not usually the bone, but if you've had a break of your elbow or something like that, that can cause it. But usually it's just the way you're made. So what I would suggest is we do this hand and get this hand good. Because if we do that hand, this hand's going to get worse. Now this hand, once we do it, you're only out of action with driving and things for a couple of weeks. With that one, you're out for about 4 to 6 weeks. So I think we should do your...
So you're saying you do one, the other one gets worse?
Well, because you won't be able to use that hand, so you then compensate with the other hand. Whereas if we do this hand and get this hand good, then when we do that hand, you've got one good hand. We can do that hand first, but I would do your easy one first and then do your harder one. Because you're going to be out of action for a longer period of time.
So what's involved?
Day case, you come in, you have a little cut on your hand. And we open the carpal tunnel from there to there. Open up where it's squashing down the nerve, and then you have some stitches. Half plaster for a week. Small risk of damage to the nerve, but the risk is very, very small. I just have to warn you about it. Then you go back to you come back and see me at a week, get you out of your half plaster, get your hand moving, send you off to the hand therapist, go to your local doctor at 2 weeks to get your stitches out, and then you come back and see us at 6 weeks. At 6 weeks, if this hand is good, we'll organise to do your other hand. Okay?
All right. I forgot my beautiful leg stockings that I got. I don't know how you can see that. Beautiful, very lovely. I'll be taking them off at home, and that was a magnificent flip I just did with the phone too.